Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is LIYANA KHOIRUN. I am from 1A class with name P172302111034. Okay, I'm here to explain to you all about the parts of body and body pain. The first of all is mood. And what is the function of the mood? The function of the mood, in the mood there is a digestive process, which is where mechanical and chemical digestion occurs. The mood function to chew food to become smoother so that it is easily digested. It contains the accessory organs, namely the tongue, teeth, and salivary glands. Disease of the mood. There are several diseases in the mood, namely, first, gingivitis. Gingivitis or inflammation of the gums is a condition that occurs due to poor oral hygiene or the accumulation of tartar. Infection will occur in the gums caused by the abundance of bacteria in the plaque and tartar. Gums abscess. Gum abscess, this condition is characterized by the discharge of pus from the gums. Next is glossitis. Glossitis not only in the gums, the tongue can also become inflamed. This inflammation of the tongue is called glossitis. Sprue. Almost everyone has experienced something called canker sores or stomatitis. The fungus Candida albicans is the cause of canker sores. Next is dental caries. The disease, which has another name, dental caries, a type of infection that can trigger tooth structure damage. And the last one is tooth tumor. And the next is jaw. What is the function of the jaw? The function of the jaw. The jaw or jawbone helps define the shape of the face. In addition, this bone is where the upper teeth grow, and from the roof of the mouth, the bottom of the eye socket. Thus, these bones also play a major role in supporting the process of chewing and speaking. Next, disease of the jaw. One, temporomandibular joint disorders. The jaw joint is responsible for controlling the movement of the lower jaw to the upper jaw. Jaw pain caused by joint disorders can be triggered by the habit of pressing the jaw when feeling anxious or stressed. The habit of yawning too widely, especially in the jaw joint, injury to the jaw joint or muscles, or the habit of moving the jaw while sleeping. Next is toothache. Pain during a toothache, especially one that also affects the bones that support teeth, can radiate to the jaw, causing jaw pain as well. Next is sinus infection. Sinus are cavities in the skull spine that can become infected either by virus or bacteria and experience fluid buildup. This can result in increased pressure on the jaw and trigger jaw pain. Next, trigeminal neuralgia. Trigeminal neuralgia occurs when a nerve is compressed or damaged, specifically the trigeminal nerve, which transmits signal from the face to the brain and control the facial and jaw muscles. Next is osteomyelitis. Osteomyelitis is an infection of the bone and the tissue around the bone. This condition can also occur in the jawbone and cause pain. Okay, and the last part of body is stomach. Stomach. The abdomen is the part of the body that lies between the chest and the pelvis. The stomach is also known as the abdomen or body cavity. The abdominal region includes the anterior abdominal cavity, which consists of the digestive tract and accessory organs, urinary system, and spleen. The digestive tract includes the stomach, large and small intestines, and the appendix, will the appendix consists of the liver, pancreas, and gallbladder. The urinary tract includes the kidneys and ureters. These digestive organs tend to move, expand, and push against each other, but, but, but are still bound by a bundle of connective tissue. This cannot the mesentery. And next, types of stomach disease. Disease and conditions affecting the stomach are considered to be of gastrointestinal nature. The most common problems are appendicitis or appendicitis. This is an inflammation of the appendix, a small organ that attacks to the base of the large intestine or colon. Generally, an inflamed appendix must be surgical removed to prevent it from bursting, as this condition is very life-threatening. Life-threatening. Okay. Next is constipation. Constipation. Medically, a person declares constipation if he only has bowel movement less than 3 times a week. Constipation can be caused by several factors, but it's usually a symptom of a specific disease. And the next is hepatitis. Hepatitis is inflammation of the liver. Generally, hepatitis is caused by a viral infection or immune system disorder. The risk of contracting hepatitis will increase if the liver condition is threatened, threatened due to frequent or too much consumption of alcohol or illegal drugs. Okay, the last for me. Thank you for your attention and keep fighting. Assalamualaikum warahmatullahi wabarakatuh.